Like many others, you probably have questions about the 2019 coronavirus. And one of those questions may have to do with how the virus is able to spread. First, some brief explanation about the coronavirus itself. The clinical name for this novel coronavirus is actually SARS-CoV-2. It stands for Severe Acute Respiratory Syndrome Coronavirus 2. It originated from a family of other viruses trusted source that cause respiratory diseases like Severe Acute Respiratory Syndrome, SARS, and Middle East Respiratory Syndrome, MERS. Because the novel coronavirus is a new strain, it's unfamiliar to our immune systems. And there's not yet a vaccine for it. Healthline's coronavirus: if a person contracts the virus, the result is the disease called COVID-19. Being a respiratory virus, it's transmitted through respiratory droplets. Let's take a closer look at how the novel coronavirus spreads from one person to another, and what you can do to protect yourself. How does it spread from person to person? Person-to-person contact is thought to be the main method of transmission for the SARS-CoV-2 virus, according to the Centers for Disease Control and Prevention, CDC trusted source. Imagine sitting next to someone with a SARS-CoV-2 infection on the bus or in a meeting room. Suddenly, this person sneezes or coughs. If they don't cover their mouth and nose, they could potentially spray you with respiratory droplets from their nose or mouth. The droplets that land on you will likely contain the virus. Or perhaps you meet someone who contracted the virus, and they touched their mouth or nose with their hand. When that person shakes your hand, they transfer some of the virus to your hand. If you then touch your mouth or nose without washing your hands first, you may accidentally give that virus an entry point into your own body. One recent small study trusted source suggested that the virus may also be present in feces and could contaminate places like toilet bowls and bathroom sinks. But the researchers noted the possibility of this being a mode of transmission needs more research. Pregnancy and breastfeeding. Medical experts haven't determined whether a woman can transmit SARS-CoV-2 in utero, through childbirth, or through her breast milk. The CDC currently recommends trusted source that mothers with a confirmed case of the virus, as well as those who may have it, are temporarily separated from their newborns. This separation helps decrease the risk of transmission. Women should speak with their healthcare providers about the benefits and risks of breastfeeding. The CDC hasn't released any official guidelines regarding whether women with confirmed or suspected cases should avoid breastfeeding. They have, however, suggested that these women take the following precautionary measures. Trusted source. Wear a face mask while breastfeeding, if possible. Properly wash their hands before holding or breastfeeding their infant. Properly wash their hands before touching a bottle or breast pump. Clean the breast pump each time it's used. They should also consider having someone who isn't sick use expressed breast milk to feed the infant. Can someone spread the virus even if they don't have symptoms? Right now, the World Health Organization, WHO trusted source suggests that your risk for contracting the novel coronavirus from someone who isn't showing any symptoms is very low. But here's some sobering news. Experts do believe it's possible that someone with a novel coronavirus infection could transmit it to others. Trusted source. Even if they don't show any symptoms, or have such mild symptoms that they don't really know they're sick. According to the trusted source, a person who has contracted the virus is most contagious when they're showing symptoms, and that's when they're the most likely to transmit the virus. But someone may be able to pass on the virus even before they start to show symptoms of the disease itself. The symptoms may take anywhere from 2 to 14 days to show up after exposure to the virus. One recent study trusted source of 181 patients with COVID-19 found a median incubation period of about 5 days, with more than 97% showing symptoms by 11.5 days after exposure to the virus. Can you pick it up from infected surfaces? Think of all the frequently touched surfaces where germs can lurk: kitchen counters, bathroom counters, doorknobs, elevator buttons, the handle on the refrigerator, handrails on staircases. The list goes on and on. Experts don't know for sure how long the novel coronavirus can survive on these surfaces. But if the virus behaves like other, similar viruses, the survival time could range from several hours to several days. Trusted source. The type of surface, the temperature of the room, and the humidity in the environment may play a role in how long the virus can survive on a surface. But since we don't know for sure, if you think a surface may be contaminated, clean it thoroughly with a disinfectant. A diluted bleach solution or an EPA-approved disinfectant is likely the most effective trusted source cleaner for this purpose. And if someone in your home is sick, frequently clean those surfaces. Remember to thoroughly wash your hands afterward. How to protect yourself. It can be difficult to avoid being exposed to the virus, especially if you're often surrounded by other people. But, according to the trusted source, there are a number of things you can do to protect yourself. Stand back. Try to stay clear of people who are coughing or sneezing. The hot trusted source suggests staying at least 3 feet away from people who may be sick. The trusted source suggests an even wider berth of about 6 feet. Wash your hands frequently. Wash your hands thoroughly with soap and water for at least 20 seconds every time. Use alcohol-based hand sanitizer if you don't have access to soap and water. Look for a product that's at least 60% alcohol. Trusted source. Avoid touching your face. You can easily transmit the virus from your hands to your mouth, nose, or eyes without even realizing it. Stay home. You may hear this called social isolation. Staying away from groups of people may help you avoid being exposed. Right now, experts are suggesting that it's not necessary to wear a face mask to protect yourself from getting sick. However, according to the trusted source, people who are sick should wear a mask if they're around other people.